This week, the BMA published guidance to doctors about how to decide who lives and who dies during the pandemic. The guidance recommends that critical care is denied to people that might take longer to recover from Covid-19. In essence, thousands of the most vulnerable people will be denied treatment and left to die. I'm John. I'm 39 and I have Duchenne muscular dystrophy, a rare genetic muscle wasting condition. I started using a wheelchair when I was 10 years old and gradually saw my muscles deteriorate, and now I use a ventilator to breathe. But based on my current health, I could live another 15 years. If I get sick and go to the hospital, under this guidance, I will likely be denied critical care, based on an assumption that I will take longer to recover. I'm angry about this, but most of all, I'm just scared. My life is valuable. I have a PhD. I'm the CEO of a small charity supporting others with my condition. And I volunteer for NHS England. I have a husband and a loving family. I don't want to die. How did we get here? Why is the first response by the medical establishment to decide who lives and who dies, rather than urging the government to take much bigger steps to provide more critical care places? Why are we asking our frontline staff to make heart-wrenching decisions on who to save? How is anyone okay with this? This is a resource issue, not an ethical one. I understand the rationale for doing this, and I want to save as many lives as possible, but surely not at the cost of our humanity. Our system has always protected the most vulnerable. Now we are told we will be sacrificed. I knew from an early age that my life would be shorter, but the NHS has always been there, providing amazing support. I've done everything I can to give something back, and everyone else is doing what they can right now to shield vulnerable people. So why are the doctors being told to let us die in hospital? We are all being betrayed. So what's the alternative? Let's demand more resources for a start, and a first-come, first-served approach to critical care. If necessary, removing it in the absence of recovery. It's an approach we already use and we all understand. It's fair and it's easier for health professionals too. It's easier to explain we'll get you a ventilator when we can, rather than you aren't worth treating. Please don't let me and thousands of others die without giving us a chance. I'm not asking for higher priority, just the same opportunity as everybody else to survive. We're not statistics, we are real people. Please don't write us off.